Hello, everyone. It's Jennifer Freiheit, and thank you again for joining me on this rainy Wednesday evening. Today was a huge day in the fight against this pandemic and in the history for Kenosha County. Several large things happened today that are unprecedented, as we are in these unprecedented times, that I would like to tell you about. But the key word I'd like to say for today and for really this whole pandemic, this whole month, is partnerships. Today really showed how great Kenosha County is and how everyone comes together in amazing partnerships and works together. So the first thing that happened today was that the Kenosha Community Health Center was able to open a drive-through testing site at Gateway Technical College, the Kenosha campus. They were able to see 18 people today, and I know that may seem like a low number, but that was by design because we wanted to be able to really just have a soft opening, work out the kinks. You know, it may take a week for us to work out any bugs in our process and make sure we can really ramp up appropriately and do it well. So it went amazing today. We learned a lot. And we're all very eager to be able to serve our residents and serve all of our clients that we're investigating and household and close contacts through that drive-through site, testing site there. I know there are many questions about getting west of the I, and we completely agree. There are future plans because it is the Community Health Center has a mobile medical unit that's beautiful. That we hope to utilize not just for COVID testing, but for many, many future collaborations and services. And the beauty of it being mobile is that we can go to all parts of the county. So there are plans in the works. Right now, because the testing site is based on referral only, there wouldn't necessarily be a perfect location because we're referring people from all over the county. I know it's a far way for some people to drive, but there will be plans to go west of the I in the future. We do want to make sure we service that part of our county. It's very important. So the drive-through testing site is up and underway. We're really excited to be able to ramp up the testing. Right now, we are only testing about 12.08% of every 1,000 people in the county. Lake County, on the other hand, just over the border, is testing 16.8 for every 1,000 residents in their county. So we are a little bit behind in our testing, and hence this drive-through testing site will help that. We are looking at some projected modeling out of Harvard University that is telling us that for Kenosha County's population, we would need to get to 257 tests per day in order to have really good containment and accurate data from COVID-19. So that is our goal based upon science that we're reaching for is 257 tests a day. And I think that within the coming weeks that will be completely plausible given our current testing facilities at our hospitals and now this new testing site as well getting on board. So currently we're really just at 61 tests per day average. Obviously that fluctuates, but averaging 61 tests per day, and we need to get up to that 257 mark. So I have every confidence now that we will be able to get there. Another big thing that happened today was that we had called for the National Guard to come and look at some of our workplaces that have outbreaks that we want to contain. And we don't want to get to the level that you're seeing in some other communities in Wisconsin where they have double digits and large numbers of positives. We want to be proactive and get ahead of it as quickly as possible. One of those locations today was, yesterday and today, was the detention center in the pretrial facility where the National Guard tested 396 staff and inmates. And so National Guard, well known for servicing our country and our state, and now they are right in our backyard and helping us. What this does to be able to test a whole facility is help us to contain the spread and to implement all of our public health tools to get ahead of it. I know that there were comments about us testing the jail and inmates and why are we doing that before the public. And the answer is that in congregate care settings, such as long-term care facilities, assisted living, and detention centers, it's very hard to social distance people. in those sorts of settings. And so a virus such as this can spread quickly, and it could be detrimental. And our inmate population is our population. And there's high inmate turnover. People come and go, staff turnover, come and go. They are amongst the population and amongst the community. And so it helps our community as a whole when we're able to test these populations. But it really is about testing whole facilities. You saw in the news last week how Parkside Manor, we tested all the residents, 32 residents there and 6 staff, so that we could contain it. Again, it's about testing everybody in a congregate care setting so that we can get ahead of it with as minimal illness and death as possible. Parkside Manor is now completely contained. They only had 11 positives and 2 positive staff and 11 positive residents, and we have that completely under control now, and that is a good thing. So you may see more businesses and workplaces where we maybe ask the National Guard or we help them in testing their own facilities so that we can get around this, box it in within these facilities. So more of that would be coming. I also do just want to state, I had a question about negative testing. It really does just mean at that very point in time that the person is negative. And I don't want people to think that once they get a negative test that they're free to walk amongst the community, they're fine forever. It doesn't take long if somebody were to leave a testing site, get a negative test, and you could be close to somebody who's positive and get it. So it's not a perfect test that allows us to maybe return to work or return to whatever former business was, but it does tell us at that point in time, which is what the purpose of that is for our public health agency to be able to put our tools into place and contain it as quickly as possible in order to flatten the curve. So I just wanted to clarify some of that. Our current numbers were at 386 positives, and unfortunately we have had 12 deaths. We have 15 people hospitalized at this time. And I do want to share with you just for a minute some data, some numbers, because we are hoping to now be able to put some numbers around hospitalizations data, and we'll be able to put that on the county COVID hub website shortly. We have had a total of 65 hospitalizations in Kenosha County, and that accounts for 19% of the positive cases we have had. This is still well below the state average, which is around 27%. We have had 17 residents in the ICU, which accounts for 5% of our total positive cases. So still relatively low compared to other parts of the country. The hospitalizations by ethnicity, we've had 42% Hispanic, 45% non-Hispanic, and 14% that are unknown. Hospitalizations by rate are 2% American Indian or Alaska Native, 5% Asian, 12% that are other or unknown, and 82% white. We will be putting these into charts and graphs, and we'll have them for you within the next few days. The state health department has also put out a recovery rate, and this is a bit hard to determine in public health, both at the local, state, and federal level, because public health doesn't have the capacity, resources, time, staff-wise, to be able to track people all the way until they recover. And so the state has determined a recovery rate based upon cases that are 30 days or older. So assuming that after 30 days, we are counting them as recovered. For Kenosha County, we are at 41% recovery rate given that metric of 30 days or older. So you will find that data on the state website, and again, we will put that on the county website, but I wanted to be able to give you those numbers as well now. I will move on to the questions. I had some good questions today, so let me just open up. The most recent one was, if wearing masks is both recommended by the county health department and is effective in reducing the spread of COVID-19, is it possible to require any businesses that are open to have both their employees and customers wear a mask as a condition of being allowed to operate? This is a really great question because we have put out the recommendation for everyone to wear masks, and we do request that businesses and their customers do wear masks in order to help continue to flatten the curve and eliminate the spread of this virus. So can we mandate it? If we needed to, we might be able to do that, but we would like to see compliance within the county as far as people taking the onus and the responsibility onto themselves. It is a sign of saying, while wearing a mask, you've read, doesn't necessarily protect you, but it protects the others around you in case you're asymptomatic and are shedding the virus and you don't even know that you have it. And so it really is a way of saying, I care about those around me and I will do my part to protect those around me by wearing a mask. So we have definitely seen instances where businesses maybe not wearing masks have led to certain illness. And so that is a way to help protect, just as hand washing, cough etiquette, disinfection. These are all various tools that we would like to see businesses using. Another question is that some people, it seems, have portrayed the pushing back of potential virus peak dates in Kenosha County as a failure committed by the people making the projections. But isn't it in reality a measure of success of safer at home policies in that the curve is flattening and the peak is no longer as high as it once was? You are correct in this assumption. It is the fact that the peak is pushed out means that we have indeed flattened the curve, and we have hard data to be able to show that the safer at home order did indeed work. The downside, if you want to look at that, is that the peak is then pushed out farther. It's not as tall because we have been able to control and contain the virus using all these various methods, especially with the safer at home order. Another question is, presumably contact tracing also includes a look back at where the patient might have picked up the virus in the first place. Are you usually able to make a rough determination? The answer is not usually. There are some cases where we can make a determination because maybe the person lives alone and they only went to one location. That's pretty easy to then say you haven't had contact with anybody else, you only went to this one location, that's likely where you got it. But for the most part, especially early on in the days of a coronavirus, when people were traveling and having lunch over here and traveling over there and shopping over here, there were so many touch points in the community that it was near impossible to determine where they got the virus from. So having the safer at home has allowed us to a little bit more pinpoint, especially some of our essential workers who are doing nothing but going from work to home. So that is where we're looking at the businesses, and that's our biggest need right now is working with businesses and educating and helping with social distancing. Last question, how many health department staff members are currently working in the area of contact tracing, and does that number represent an increase over the past few weeks? So early in the days, as I was mentioning, when we were contact tracing, somebody may have said, well, I ate lunch with these 3 people, and then I went shopping, and then I rode the bus, and then I went to work, and then I went to church. And we contact traced all of those sources, all of those touch points in the community. It was an immense job. We had some people with hundreds and hundreds of touch points that we then had to reach out to. Our contact tracing team at that time was about 25 people deep. With the safer at home order, we are now down to only 5 people on our contact tracing team, and they're able to manage that at this time. We are looking at post May 26th, and when we're able to start slowly opening back up our communities, that we need to ramp back up our contact investigation team because there will be more touch points after May 26th. So it has not increased over the last few weeks. It has decreased, actually, the number of people on our contact tracing team. That was a good question. And let me just check in case I had any other questions. And it looks like there are no new questions either on my phone or in my email. So I would just like to wrap up tonight by saying Kenosha County is amazing. The partnerships have been out of this world in how fast everybody has pulled together. There is something to be said for this pandemic in that it's creating partnerships that would have taken years to develop in normal times. And the fact that people are able to ramp up and rapidly work so quickly to pull off enormous feats is just really mind-blowing. So kudos to everyone in Kenosha County for chipping in, every sector, every partner, every industry, and really taking this seriously and making it work. So I thank everyone out there who has really helped to bring us together and to collaborate and to help stop the spread and flatten the curve of this coronavirus in Kenosha County. Thank you so much, and I look forward to talking to you next week.